Welcome. As always, my name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber, and I want to thank you for joining us for this week's Cross-Industry Public Health Update right here in Boulder County. I want to thank you for joining us and continuing to join us each week to ask your questions, to get the information, because we know it's changing and it's changing pretty rapidly. As needed, we will add sessions this week if anything changes again. So we have a spot designated if anything changes this week. But we're here today to answer your questions, put them in the Q&A or the chat. We don't go live with hands up because we have a lot of people on these calls, but I do try to ask all of your questions on your behalf. Put them in the chat, the Q&A, we'll get to them. And at this point, I'm going to hand it over to Jesse Rounds.
Thanks, Corinne. Hi, everybody, and I will jump right in. So I'll do, as I do most weeks, a little epidemiological update. We'll talk about the current dial status, and then we'll get into some public health order information that I think might be helpful. So to start, we are in the high-risk orange category that changed last Friday. And all businesses will need to comply with high-risk guidance, and I'll go over that in a little detail, but happy to answer questions about that when we get there. So jumping into our data, we are in the middle of a spike. The whole state is in the middle of this, and our numbers climbed precipitously over the last 2 weeks, currently our 5-day rolling average is 146 cases per day, and that ends up relating to our dial status, and we'll get into that in a little bit. In terms of where this is occurring, we're seeing a lot of cases in Longmont. As you can see from this chart where it breaks it down by community, our Longmont is the area where cases are growing at week by week. So that is a concern for us. We're also obviously seeing it in the city of Boulder, and we're chasing that down as well. So by age group, and this is per 100,000 since October 1st, and you can see again, 18 to 22-year-olds still a pretty significant part of that, but we're seeing high case numbers across all age groups. And note, this is cases per 100,000, so that's a way to normalize across population. In terms of our breakdown by race and ethnicity, again, we're seeing an unfortunately large number of cases in the Hispanic Latinx community, and that has been a focus of our outreach efforts for some weeks now. This is a slide I haven't put in before, but there were questions last week about hospitalization and about resources, and I wanted to show sort of our tracking of our resources in the county. It's a little bit hard to read, but I think in most cases we're in a good place, but where we see concerns are available beds and available, in particular, ICU beds across the county. And one thing I wanted to discuss, there have been questions, comments, concerns about, well, why are there people from outside the county in our hospitals? And hospitals don't recognize boundaries. They go where the services are available, and the hospitals are there to take care of people. Doesn't matter where they're from. So we have residents in hospitals outside of Boulder County. Our hospitals are taking care of people from outside of Boulder County. That's just how hospitals work, but the state is tracking by residents in terms of what counties are seeing hospitalization happen to their population. So just want to try and address that, and I'm happy to answer questions about that when we get to that stage. Another way to look at this, so this is the hospitalization in Boulder County, and again, we're seeing a huge spike in hospitalization. So our key takeaways are we're seeing rising case numbers. We're seeing rising case numbers in long-term care facilities, but we are seeing it across all age groups. Long-term care facilities were a place where we saw a huge number of new cases early in the pandemic, and then it actually decreased significantly, and we're seeing really good numbers. Unfortunately, that trend is no longer in a good direction. As I said, hospitalizations are increasing, and then unfortunately, mortality. Uh, we had not seen much mortality since the beginning of the pandemic, and unfortunately, since October 1st, we've had 18 deaths. So that's also a way of looking at the severity and impact of the disease across our community. So as I mentioned before, we are in level 3, what used to be called level 3, the high risk or orange level of safer at home. Again, that's tracked by new cases per 100,000 on a 2-week interval, our percent positivity, and whether our hospitalizations are increasing, decreasing, or stabilized. And our current rate of cases per 100,000 over 2 weeks is 458.8. I did not look this morning to see if the numbers had increased. This is from yesterday, but you can see that the entire metro area is in this same situation. The numbers may differ, but we're all in the stay-at-home level for 2-week cumulative incidence rate.
We're at 504 now.
Oh, thanks. That's not good. Our 2-week testing positivity, unfortunately, another situation where we had for months and months been in a really good position where our positivity rate was quite low. Since October, basically, it's been slowly increasing, and now we're at 7.1% positivity. Again, echoing much of the metro area in terms of positivity. And our hospitalization status, this is actually a change from last week. And again, unfortunately, while we're seeing hospitalizations increase, the data is showing that our population in Boulder County, that population is decreasing or stable. That's a fortunate statistic, I should say, but unfortunately, I think what we're seeing is that the whole metro area is seeing this increase, but it's not necessarily related to population in those counties. Hard to understand, hard to track, but I think the important thing is while the metric is telling us good news, the data about number of hospital beds available is not good, and that's really something we need to focus on as sort of a way to understand how our actions need to change. So jumping into the guidance for high risk levels, and I'm not going to spend a ton of time, I'll just flip through these slides, but I think the important thing is the high risk guidance is about capacity. Your practices need to remain the same across. If your sector had specific practices that were governed by the guidance from the state, they need to remain the same. The difference is your capacity indoors, and in some cases, capacity outdoors. One thing I do want to mention is as of this week, the state has clarified that indoor sports which are not allowed right now, include practices. So indoor sports practices are also not permitted. That's a big change. We've reached out to rec centers to try to address that. Happy to talk about that with gyms that might not have known that, but we do need, that is the state's interpretation at this time. And then just to sort of reiterate what can be done, it's the same things we've been talking about from the very beginning. Require mask use. You as a business owner have the right to either provide alternative services to people who won't wear a mask or cannot wear a mask, or say, I'm sorry, I can't, we can't have you in the store. Requiring mask use really does protect you and other people in the store. Following state guidance as closely as possible is also an important step. Washing your hands, socially distancing, and limiting group gatherings. The governor released a letter last week, and it's been echoed by public health officials across the state. Really reducing the number of people, trying to basically, when you can, act as if you personally aren't under stay at home while you're still able to go to stores and all those things. Behaving as if our communities under stay at home in terms of our personal behavior is probably one of the best ways we can slow this. Another thing that I've talked about in the past, exposure notification, the exposure notification system. It is free. It's on your phone. I know there have been some questions about what if I have an old phone. I would check with the state. They probably have some workarounds for that. But really, it aids in tracking and tracing. It allows you to know your status after you've been out and about in the public, and it helps public health and you try to stay safe. So there are, what does the future hold? That's the question we tried to answer last week on Wednesday, and then things changed on Friday, and we tried to address that. Then new case counts are still rising, and there are likely going to be new orders, whether that be a step between orange and stay at home, or the governor putting us in stay at home. I don't know. There has been no indication of either of those happening, but I think it's really important to be aware of that. And Corinne and I have talked when we're not in these meetings about what it means to be a business owner and what it means to plan for the future with all this uncertainty. And so I think it's really important to imagine what happens if we go to stay at home. And so I want to go over the stay at home guidance. It's a number of slides. It's going to take some time, but I really feel like it's important for you as business owners and managers to think about the possibility of this happening, because.
And before you do that, we had a question come in because our numbers are in the red. We're at 504. Adams County is close to 1,000. Denver's close to 1,000. All of these counties are in the red, so we're technically in the stay-at-home numbers, but we currently are not in stay-at-home.
Yes.
That was the question that came in. So currently we're not there, but we are trending in that direction. So we want to prepare if we are trending in that direction, what that looks like.
Thank you, Corinne. Yes, absolutely. We are not required to be there. It's just good to know what the I think it's good to know. You can all tell me in the comments afterwards that was terrible and I don't want to know about it, but I feel like it's good to prepare. So under new stay at home, there are no group gatherings except for essential activities. That's no getting together with other households. That's staying at home with your household alone. Non-critical office-based businesses must be closed. And this second sentence here is something that comes up in the orders a lot. And we can get into this in the future, but basically the governor and his team have recognized that some businesses do need to get into their business and change, whatever your basic minimum operations to allow your business to function long term. They call that minimum basic operations. So that's true of almost all the business categories. So non-critical retail also closed. You may operate curbside pickup or delivery services. So that's a change from the earlier stay-at-home orders. For non-critical manufacturing, again, closed except for those minimum basic operations. Field services are closed. This is a thing that I remember when we came out of stay at home, there was the opportunity to do open houses for real estate that would stop under stay at home. Personal services are closed for in-person work. In other words, those personal services that are able to do online services, therapy, and things like that um, should should continue if possible. That's the same for limited healthcare. Now, limited healthcare, they actually want you to move to online services where possible, but if it is ordered by a medical professional, someone who is licensed by the state uh, to provide medical uh, care, then you can operate at 25% capacity, not to exceed 10 people in a room. So that is a big change from the original stay at home, but it is very specific. So if you are a limited healthcare business and you have questions about this, please don't hesitate to reach out to us. We can talk about exactly how that would work. For restaurants, you're closed for indoor dining under stay at home, but existing outdoor dining may continue. And takeout and delivery are obviously allowed as before. Now, this outdoor dining thing is really important. It's necessary that anybody who has outdoor dining now or is considering it make sure that what they're proposing and what they're planning comport with whatever your local jurisdiction's regulations are for that outdoor space. Um, the capacity for outdoor dining would remain the same from level orange to stay at home outdoor dining. But again, only if you already have outdoor dining can it continue under stay at home. Houses of worship uh, may operate at 10 or fewer people per room. And that's it. There's no uh, there are no other allowances there. Obviously, the social distancing guidance is the same for houses of worship between orange and red. And then in terms of indoor and outdoor events, there are no events permitted under stay at home. Gyms and recreation centers are closed except for those that are within a condominium or some sort of congregate housing, hotels, that sort of thing. And outdoor recreation may continue at 10 or fewer people, socially distanced, wearing masks. And so that's all of my stay-at-home prepping. And I know from talking to Corinne yesterday that there were still some people interested in the sick employee versus outbreak advice. I can go into that more at a future date, but I wanted to provide a lot of time for questions and answers today. But I will do a quick explainer here. A single sick employee doesn't make an outbreak. 2 employees, though, over a 14-day period can be an outbreak. If it turns out that those 2 employees don't work the same shift, work opposite sides of the building, we will activate as if it were an outbreak, but it does not affect your business in much the same way. So, rolling back from outbreak definition, a positive employee has tested positive for COVID. So, if you have a probable employee, someone who was a close contact, that is different from someone who has tested positive for COVID. A close contact is someone who has been around a person who has tested positive and they've been around that person for more than 15 minutes in a work shift or 24 hours. So that's, you'll hear that a lot. If we work with you, if you have a single sick employee, we will ask, were there any close contacts? Were they around their family? Those sorts of things come into effect with what is a close contact and what does that mean for your business. So another question that seems to come up a lot, the difference between quarantine and isolation, and I'll get into both of those terms. And then the state guidance is worded in a very funny way, and I want to sort of try and clear up some of that confusion that I think comes from the wording of that. Employees must quarantine if they have been in close contact with a person who has tested positive, whether that be a coworker or a family member or a friend. They need to quarantine, and quarantine is 14 days regardless of whether they have any symptoms. They may get tested if they develop symptoms, but should wait at least 7 days from the beginning of quarantine. That has to do with the incubation period of the virus and the viral load in people over time. The state's order mentions this 7-day testing wait in a very weird way that makes a lot of people think that if they test after 7 days, if they test negative after 7 days, they can leave quarantine. That is not true. You must complete the 14-day quarantine. Isolation is only for those who test positive for the virus. In isolation, uh, uh, you must isolate for at least 14 days and at least 4 days beyond their last symptom. So that's a, you know, I think that's a really important detail. If you continue to have a fever when 14 days passes, you've got to keep in isolation. So just a bit of detail there. And to sort of get back to the testing, testing is a good tool along with tracking and tracing. Those are our basic tools for understanding how this virus is spreading. But it can only tell you if you are negative or positive at a single point in time. If you test negative today, that doesn't mean you're not going to be positive tomorrow. So it is a point in time test. And again, it cannot be used to shorten or avoid quarantine. Testing does not get you out of quarantine. And with that, we are doing, I'm sorry, this is an old slide. We're doing this session now at 3 p.m. We do not have one scheduled for 4 p.m. this week. However, as Corinne mentioned, if there are any updates, like last week, we've reserved Friday at 1 p.m. In order to give you any updates and discuss any more details. And then the Spanish language session, still planning to release that tomorrow. That's in collaboration with the Latino Chamber. And really encourage people to listen into that. If you have any questions, please don't hesitate to email us. And if you have any concerns or complaints, definitely call the call center, and we will follow up on those. And with that, happy to answer questions.
So the first thing is that we have reserved Friday at 1 o'clock. I put the link for that session in, so that people want to just put it on their calendar just in case. The reason we did that is, the next step would probably be the strengthening of the current orange orders if there was any need to do that. And we know that the Board of Health does meet this week, so that would be the first step. So we reserve that time. If you want to put it on your calendar, that is what time Lane, myself, and Jesse have reserved to have available for questions if any additional orders come out. We are going to continue to offer those types of sessions for these types of changes that happen. That's what time we did it last week. We'll continue to do stuff like that and have registration. If you want to register for it, nothing happens, then we'll let you know. And I will send out an email if anything changes. We had some people that joined late, and they joined in the middle of your stay-at-home slides. So we freaked out a bunch of people who now think we're in stay-at-home. So I put in the chat that currently we are not in stay-at-home, but what you were doing was you were preparing people for what stay-at-home looked like. Just like a few weeks ago, you were preparing people for what orange or level 3 looked like if our numbers did not improve. We're currently at 500 and 504, 508, and other counties are at in the red range. So if our numbers do not improve and we continue the trend, which is an increasing trend every day, then that is a possibility. And what stay-at-home looks like are what you were going over. And so currently, when someone came on and you said gyms would have to close except for virtual or outdoors in groups of 10, people ask questions like, well, the rec center was open this morning. Are they going to have to close? No, we're currently in level orange. That is if we move to stay-at-home, correct?
Absolutely, yes. Thank you for the clarification, and I'm sorry for scaring everyone.
Okay. All of that goes into effect if we move to stay-at-home. And the order that I put into the chat, and then Lane also put into the chat, the link to the dial framework, which if you click on the stay-at-home link within that dial framework. It has the nice little colored chart that has the capacity limits. And in that capacity limits, it shows you what stay-at-home looks like for each of the industries. All right, so yeah, sorry I came in late. Are we in stay-at-home? No, we're not currently in stay-at-home, but should people be operating as if we're in stay-at-home to try to get our numbers down?
So, I mentioned this before.
Elaine, go ahead. You shook your head. You were going to say something.
No, I mean, I think Jesse's mentioned this many times. The foundational things are important regardless of what stage we're in. So people screening your employees, making sure that have people wearing masks and social distancing, cleaning your facilities, that's foundational. So you don't need to restrict your operations even more so until we move to that next level. Again, we feel like businesses that are on this call, you're doing a good job. So don't hurt yourself economically more than the orders and the levels are already doing. So we really want you to just continue to focus on those things that are within your control. Again, we're really trying to get messaging out, not specifically to this community, it's to the larger community, is that it's the personal gatherings where people are not social distancing, not wearing masks, have more than 10 people, more than 2 households. That's where we're seeing transmission, across the entire state. So we've got to get that under control because it has implications back to our business community and to our larger community and schools and all those things. So you don't need to start operating that. You should, as Jesse was trying to do, get prepared for what that could look like. So if you haven't set yourself up to be virtual and be able to do online sales where that makes sense for your business, you really need to invest in doing that. But for those personal services and things where people need to come into your business, don't close now, wait until you're closed. So don't hurt yourselves economically yet. Sorry, Jess, you were going to say something too.
Well, and I was going to ask if you can move things online to avoid having people convene, if you could do therapies online again, if you can do things online, if your employees can work from home, to avoid having more people out and about, should you move in that direction just so that we can help try to bring those numbers down?
Absolutely. Yeah. I think we've always advised those things. Wherever you can avoid having people interact, that is always optimal. But some businesses, that's just not feasible. And so we understand that. So taking all those extra precautions are really important.
When you're looking at capacity limits, I got this question today. Let's say, you have 19 desks and you're doing a 25% capacity. Should you round up or down, especially in this situation? It's 4.25, round down to 4 so that we're trying to stay safe.
I think rounding down to 4 is a good idea. And I also, I think we mentioned this last week, but I should reiterate, and this question is perfect for that. Your capacity in office spaces is not based on your fire code capacity. It's based on what your pre-pandemic office had. So 19 employees. If there were 19 employees in the office every day, then your capacity now is 25% of that 19. So yeah, but I would definitely round down if you're looking at numbers, just to be on the safe side. Because remember, the big thing is anybody who's in the office needs to be socially distanced. Their desks need to be 6 feet apart. They need to be wearing masks. All of those things need to remain in effect.
And again, for office spaces where you can do virtual work, you should just do that instead of having people there. But not all businesses have that luxury. So where you do need people in the office, you need to minimize that.
Looking at the data, is there a place that shows historical data for the number per 100,000 over a 14-day period? And that number per 100,000 is actually the average over 14 days, correct? Or
depends on which data point. If you're looking at the slides versus the COVID dial.
So do we have something that shows historic? I mean, on the Boulder County Public Health website, it does show different data point, which is a trend line over time of, average cases over time. This is a little different because this dial was introduced a little later.
Yeah, I
Yeah,
don't think we have anything online. It's something we could create if people want to see it, but I think the easiest way to think about it is we were very solidly in, um, level 2 when the dial was introduced, and then we had our spike from the college students, and that pushed us just into uh, level 3. But we were able to stay out of it because we worked with the state, and now we see our numbers where they are. We had a huge decline back into level 2 again. That was great, and now we're seeing that spike again.
and Jesse, if you show the 5-day case count, I mean that trend is going to be the same line for what the other one is. So, this one's maybe steeper, but again, what Jesse's showing there, that's exactly what's happening with the dial metric too. It's just been slowly moving up. We were at 300 and some, and now we're at 500 and some. So we're jumping up pretty rapidly.
So this is a 5-day average of cases, and
Yeah, this is not the same metric, but it's the same trend.
yeah, it's the
Right.
same. It's the same idea. It's an average over time of cases. Of cases. Yeah. Can we talk a little bit about testing and quarantine times? And there's a lot of confusion out there.
Absolutely.
Yeah. So if you have been exposed, how long do you need to quarantine?
14 days.
14 days. If you quarantine for, let's say you go and get a test and it says you're negative, how long do you need to quarantine?
14 days.
14 days. How long, even if your test is negative?
Yes.
Okay. Why is that?
Because a test is a point in time metric, or metric is maybe the wrong word. It tells you what's happening right then when you take the test. And you can become positive right after you take the test. So, the 14 is based on the incubation period and the general trend for the virus. It's intended to recognize that it takes time for the virus to build in your system, and then it takes time for it to play out.
Jesse, I think we're
And I got my
a
frozen.
little bit.
Yep.
So Lane, will you cover
Is that
that?
better?
I think Jesse's frozen.
Yeah. So Jesse was basically sharing that the virus has an incubation period and it can be up to 14 days. So testing during that 14 days just means you're not sick whenever you were tested. You still could become sick up to 14 days after that exposure. So that's why you can't get a test and then stop your quarantine.
And so we've heard there are some, some doctors or some, people that are being told, oh, you tested negative, you can go back to work. So we've gotten calls. They still, that quarantine time is 14 days. So they need to stay out the 14 days, even if they're told something different. And the state website does clearly say 14 days. Now, let's say they're symptomatic and they go get tested. They have a cough, they have a fever, and they go get tested. What's the guidance there?
So again, depends. If you were still a high risk exposure, you need to quarantine. So there's no reason to test once you're required to quarantine unless you become ill. Then you should get tested just to verify now you do have COVID. Now you have to move into that isolation requirements. But if you're just sick and you're saying, hey, I'm sick, I'm going to go get tested to see if I have COVID. Now you're just looking at your symptoms specifically as far as coming back to work. So again, if you test negative, you don't have COVID, but now you're just looking at coming back to work after your sort of symptoms resolve. So.
And can you explain the difference between quarantine and isolation?
Yeah, isolation is for people who are sick with COVID. So in both cases, they shouldn't be around anyone, they shouldn't have any contacts, but isolation is the term used for people who are actively sick and they need to isolate themselves away from everyone. Quarantine is a proactive measure. So people who've been exposed to somebody who had COVID, they quarantine because they're at a high risk of becoming sick and we don't want them spreading it to other people. Again, with this virus, it can be a situation where you can be shedding the virus 2 days before you show symptoms. Some people don't show symptoms at all, but still have the virus and are actively shedding it. So that's why quarantine is so important, is that we stop that R naught value, or how many people that are sick turn into more sick people. So that's what isolation and quarantine really try to knock down. Once we get sick people, we have to stop them from making other people sick.
Okay. And so how long, and then the question was how long before you can return to work? And do you have to have a negative test before you return if you've been sick?
No. So again, I think I posted in the chat earlier the isolation and quarantine stuff. So for isolation, you're looking, and Jesse talked about this, once your symptoms are resolved, you have no fever for at least 24 hours. Then you have, 10 days since your illness began. Those are kind of the numbers you're looking at as far as when you can go back. And you can't be using medicines to stop your fever. So you can't be taking, Tylenols and things like that, and acetaminophen. So I posted all that in there. So it's really looking at when did your symptoms begin? Has it been at least 10 days? So that's the likely kind of overall duration of the illness. Also, the fever for sure has been gone for at least 24 hours. That's when you can return now to work.
And I appreciate you actually repeating it. We have a lot of people that watch this and don't get to see the chat.
Yeah.
The last piece we have, and we have a couple questions about this, you do need to quarantine if you've had it before, you've been exposed.
If you have had COVID before and now you're sick again,
or you've been exposed.
If you're a high risk exposure. Right now, the number of days is 3 months. So 90 days is what we believe that you should have immunity. So I don't know that that's addressed in there. Is if you are for sure a COVID sort of recovered person, that are you now exempt from all these pieces? Typically we say 90 days. So we aren't asking people to retest or do any of those things, but I don't think any of the guidance has any of that information has been added into it. Again, you should have immunity for 90 days.
And if one of your employees, you're doing your symptom check and they say they have a temperature, a slight temperature, how long do they need to actually stay out? They don't have a confirmed exposure. They just, in their symptom check, say they have a temperature.
So again, if you have symptoms, and you should get tested, that's the first thing. Then the other piece would be, and it comes back negative, now you're looking at that 24 hours after the resolution of your fever, you can come back to work.
Okay.
And that's just in general. I think that's a way to prevent the flu and all these other respiratory diseases, is people who have a fever and are sick should not be coming to work regardless of whether it's COVID or not, because they're going to make other people sick. And it still has impacts to your workforce. And so we don't want people spreading any respiratory diseases. So they really shouldn't be at work when they have a fever, and they should wait 24 hours.
And can you clarify again what that fever number is?
100.4, I believe, is the fever threshold.
Jesse, will you go back to the testing slide?
Yes. Maybe.
And while you're doing that, so we had asked somebody to say that, we should talk about the fact that the Stasio testing site is closed today, but will be reopening tomorrow. Thank you to the City of Boulder. And that one will be open again at the Stasio site in City of Boulder. And then the Fairgrounds in Longmont has just opened. That's 7 days a week, and to check the Boulder County site. And then Nederland and Lyons both have drive-through sites as well. So the Boulder County has information on the Fairgrounds, the Stasio, the Netherland, and the Lions site, as well as a link to other sites, including one at Waterworld and some other places to show where there are testing sites, free testing sites around the area. So speaking of testing. All right, so we have a question about, we realize that this is a moving target. Are there any idea if there are any date ideas about, with numbers going up, if there's any date ideas on when we could potentially move to stricter levels?
We're anticipating that the board is going to add some restrictions tomorrow, not to move us to stay at home, but to certainly look at gatherings and areas where we're seeing large groups. So further restrictions beyond just the orange level. I'm not sure about the governor. I know that there's sort of a mix across the state of jurisdictions wanting the governor to just proactively move everyone there versus, leaving it at each local level. But we have no idea for sure if the state will make some decision like that or not.
It doesn't matter. If you work in a small staff of less than 10, does the outbreak guidance change for small staff versus large ones?
It does not.
No, 2 people, is what triggers an outbreak within that 2-week period. That being said, they need to have had common exposure. So that's 2 people got sick at work, by working around each other, stuff like that.
You guessed another question. What if everybody's been working from home and you had 2 people from the same office, they never came into the office? Does that count as an outbreak?
No, you don't. Those people should still follow all the other protocols, more so for their personal lives than work lives. But yeah, they shouldn't be around anybody. But you don't have to do anything as a business. You don't need to close an office because a remote person is sick. It's only people who have been high risk exposure, been around them, for 15 minutes.
What is Boulder County Public Health doing to address some of the emotional and psychological issues that come with further lockdowns?
Yeah, there's so many implications of what we're dealing with and have been dealing with for so long. There are a lot of resources out there. We have our mental health partners have been very active for a long time. Our community services, our housing human services, all of our, public service companions have been doing a lot of work. So there's a lot of resources out there, and we really encourage people to access them if you're feeling any need. And it is likely that everyone is feeling that need to some degree. And certainly checking in with people in your lives, checking in with your staff very frequently, because all this stuff is taking a toll. So you really need to make sure people have access to resources so there aren't stigmas for people wanting to, that may need this, that we really want to make sure people have access to mental health support.
We have a little bit of a confusion here. Someone said that, in Larimer County, the businesses are only closed for a week with positive cases. Why are we in 2 weeks? That's not the case. The individual has to quarantine for 2 weeks, right, or, isolate for a certain period of time. When there is an outbreak, there is a closure of the business. But Jesse, will you clarify what happens when an outbreak happens and how long the business closure takes place based on the conversation with the business?
Yeah, absolutely. So when an outbreak occurs, our epidemiological team works with the sick employees to make sure that they're safe and that we can track and trace who they've had contact with. Our business liaison team then reaches out to the business. The state guidance is that the business should close that day. And that's a precaution, just everyone can go home, everyone can be safe. And we will work with the business management and owners to identify who was sick and if there are ways to reopen the next day. There is no required closure period. It is based on the likelihood of the number of people who were exposed and how they were exposed. That sort of thing really drives if there's an extended closure. But I know from working with multiple businesses that a number of them have closed for an extra day out of out of caution and just sort of to work with their employees. But most businesses can go back to work almost immediately, depending on how many people were impacted by close exposure and how many people were sick. I don't know of any businesses where we've required them to close for a week or anything that long.
I think we've heard in the news of some that have voluntarily closed for a certain period of time for, cleaning and, some have, I don't know. I've heard of some that have, chosen to close for a period of time because they didn't have enough employees to reopen, things like that.
And I posted the workplace outbreak guidance. So if you're already in a situation where you've identified 2 ill workers and you're concerned about an outbreak, going into that and using that guidance proactively even before public health has contacted you, because right now there's a huge increase in workplace outbreaks. So our staffing ability to respond to people timely is really being challenged right now. So again, if you can go through this, and basically the closure is so that you can go in and clean those areas where the workers that were sick were at. So that's really the goal, is that you've kind of added that extra precaution in there before people are returning, just to make sure surfaces are all clean, even though that's a lower risk exposure. It's the sick person themselves that's the big risk, but this helps you eliminate as much of the risk as you can before you kind of resume. You also really want to make sure you've identified who else could have been impacted, so those people don't continue to work, that they move into that quarantine phase. So it gives you a chance to get a handle on things and get all the steps you need before you jump right back into operation.
How far back should you go for exposure to that sick person?
That's a good question. I want to say it's 2 days of work, but I need to look at that. So we may have to research that and get some more information for you.
Okay.
That's my recollection as well, but yeah, we should look into that.
And it's even before, because sometimes you could be asymptomatic. Someone, test positive. Because the question is, if someone's positive, how far back do you need to look to let others know?
Mm-hmm.
And is it before symptoms? Yeah, I mean, some people are test positive and they've never had symptoms. So, someone asked if we could do a flow chart, a yes, no, quarantine, 10. I mean, I actually think that's actually a really great idea.
I could work on something like that. Yeah.
So, we have a bunch. We have yoga studios. We have gyms. We have therapy clinics on here. We have a lot of different types of people on here. But if a customer or student tests positive, when can we allow them to return for classes in our facility?
So they need to be out for 14. Well, they need to be out for the duration of their illness. I think Lane went over this in terms of the number of days after your last symptom that you need to be out before you can return if you've tested positive. If you are sick, yeah.
So it's back to that isolation piece. So for the sick people, they should be following all the isolation requirements. So that, again, that's 10 days since the beginning, assuming that they've, all their symptoms have resolved and they've had at least 24 hours of fever free without using medicines to reduce fever.
Jesse, when you do speak, you need to speak a little louder if you can,
okay,
please.
Sorry, yes, I can.
Okay, and then on the outbreak, if 2 people in an outbreak for a business, is it considered an outbreak even if they don't get it from one another?
Yes, sort of.
Yeah, those are all difficult questions. So it depends on if they have a known exposure that was outside of work, that's the likely cause of their disease, and the fact that they both work together, it doesn't mean that there's necessarily an outbreak at that work. So that's what the outbreak investigation team is trying to discern, is the workplace the location where the disease is spreading, or is it just that these 2 people both were attending parties outside of work, got sick, and then they happen to work, at the same location. So that's what we're trying to find out. Yeah. And that's not always easy to determine.
Yeah, I've heard, I was talking to somebody in another county who said they traced some of the work events to people actually going and socializing outside of the work hours, going and having a beer, taking off their, outside the work hours. And it was that socializing time. Even some of the things you read in the news, some of the outbreaks at the schools were actually things that happened outside the schools. But it actually came back to happen or close down some of the classrooms and expose some of the teachers. We had a question in the chat about if you see an infraction or something not happening correctly, who do you contact to report that? And so I put the online form in the chat for
You can
reporting.
also call our call
and
center.
You can also call the call center or email. So I put the form in, and then we have also this information right here. Okay, we have some clarification. We have some clarification on stay at home. I think some of the stay at home because people want to just get prepared. For stay at home, it does include curbside delivery to operate for retail, non-essential or non-critical retail. Is that correct?
Yes.
Okay, that's a slight difference from the last stay at home from the last time.
Yep.
So non-critical retail would have a curbside delivery operation for retail. When it says that, let me go back to this other question. When it says that you could operate outside for gyms, have some outdoor activities that include outdoor pools?
I'd have to check on that specifically. I don't believe so.
And then dentists and orthodontists do not fall under limited healthcare, correct? They're under actual medical services. So they're not actually following under that limited healthcare that you're talking about. They would fall under different guidance, correct?
That is correct, yes. If you are a critical business, you have slightly different guidance. I definitely would check the critical business list, which is Appendix A of the current public health order, gives you the full list of what is considered critical. And those businesses do need to operate with social distancing and masking and everything, but they are not asked to close or even to have capacity limits.
I put the link to the order back in the chat, and it's page 33 that the Appendix A begins on, and that lists the critical businesses for that. All right. So speaking of stay at home, would counties go to stay at home based on their own metrics, or can the governor shut down entire state or groups of counties at a time?
The governor can do that. I don't know if the governor will do that. So the governor has moved some counties already, but not moved the entire state as a whole. The governor's changed the dial, but has not moved everyone to orange, but has moved counties to orange. So, but the governor could do that.
Okay. Lane, you mentioned that you anticipate the board will possibly add capacity gathering restrictions. What might these look like? Reduce size of groups, curfews. We've talked about how other counties have curfew. I've heard that there may not be much appetite for curfew here in Boulder. What might these look like?
Yeah, I don't think there's going to be any kind of curfew. I think it's going to look at kind of spectators at events, events themselves, thresholds on those. It's really going to focus on gatherings. So, but I don't know. It hasn't gone to the board. I haven't seen a final version. And then the board has to look at it and the board has to make decisions. So I can't tell you what that's going to be until the board actually makes decisions, but that's the expectation. It would be on operating limits for really gatherings and things like that. There probably is going to be focus again on groups really staying within your household. So that could be something that hits restaurants, really, that not having large groups, certainly multiple households, really trying to get that down to single households. Again, all the messaging is please don't interact with lots of other people. Try to keep within your household. I don't know if folks saw the state epidemiologist kind of went and had a messaging around the state of at least through the end of November, if not into December, is really don't interact with people outside your household. That's really the goal. Whether that becomes orders or not, that's definitely the recommendations.
And right, and like we said, there's not much appetite, not much for a curfew like Denver has or Pueblo has right here in Boulder. So we're not foreseeing that as a possibility. Right now, there is a 10 p.m. last call on alcohol already. Right, that's part of moving to orange. There's reduced capacities, those types of things already exist. And if anything does change, like we said, we'll forward that on. And if that impacts businesses, we'll offer an additional time to try to explain that or allow you to ask questions, see what resources we need on Friday at 1 o'clock. Do you see the board making changes to gyms and rec centers?
I think just gathering stuff. So where rec centers may host events, that could be something where, again, those indoor events may see a smaller threshold. Certainly spectators at events are something that we're really concerned about, and that could be limited. But as far as what the dial allows for your operation, I don't see changes there. So again, you'll still be operating under what the dial allows for classes and things like that. We definitely recommend outdoor activities as much as possible. Obviously, the weather has an influence on how much that's viable, but we know the indoor risk for transmission is dramatically higher than outdoor. So indoor activities are just in general higher risk.
And right now, I mean, without a lot of this is just speculation because the Board of Health actually hasn't met and discussed this. And so we're just, right now we're looking at, a lot of this is about gathering, stay within your household. The specifics, is this going to affect swim classes? Is this going to affect gyms? We don't know. So like, that's why we offer, maybe hold the 1 o'clock spot on Friday, because who knows if there's going to be additional orders or those additional measures. If they happen, we want to offer that opportunity for you to get your questions answered.
I don't anticipate locally that happening, but that could be something where if the governor makes some larger decisions, then that would change things for everyone. So
yeah. And again, and then if the state does it, you guys enforce it locally, and we try to do the best we can to also interpret or get the answers for you locally as well. Would Boulder County Public Health move to a city restriction within the county at stricter levels instead of the whole county at some point if you see a spike within a certain city?
So we work closely with the cities. They would make those decisions. So the city of Boulder has implemented a number of public health orders. There's been a lot of work with Longmont over the last several weeks, given that there's been a high amount of cases coming out of Longmont. So, I think there are definitely needs that every municipality needs to certainly be looking very closely at what's happening and making sure that, again, the personal gatherings are not happening. So we really need to find a way to influence that.
Okay, so looking at now, let's go back to orange level, and we're talking about office space and 25% capacity. It doesn't matter your square footage. It's not about your square footage. If you have the capacity for 100 employees and you have 100 desks, and that's what your pre-COVID numbers were, the new guidelines are now 25% of that's 25 employees in the office, correct?
Yes.
Okay.
So you should be looking at whatever your max capacity of employees is, that gets reduced by 25. Not if you right now only have 2 people, you have to further reduce it by all the way down to 25%, which is not even a person. So again, if you've already made all these reductions, then you may have proactively already limited yourself, but it isn't based on what you're currently doing today. It's what your pre-COVID capacity was.
And we have quite a few very nervous personal services providers on the call, as we can imagine, and they're wondering if a stricter level orange would shut them down or just a red. a red level, and the orange, a stricter level orange, are you foreseeing that would be a shutdown for them, or just if we move to a stay-at-home?
Yeah, under orange, they're not closed. So it's still looking at that capacity. So that 25% or 25 people. So certainly people that have just a single client, that's all within purview. Doesn't mean it's still not risky, especially if people have services where they're not wearing a mask. So it's, again, probably more of a risk to them than it is their clients. But we are not projecting that locally. If we go to level red, then that would shut those down.
Going back to that office scenario, does it matter if everybody's working in individual offices within your office space?
No.
Okay. So, and I've heard a lot of people say, why 25%? And the idea behind it is to reduce the number of people within the space, just in general, the number of people that are, convening in our community. It's reducing it down 20 to 25% of pre-COVID numbers.
Yeah, it's limiting interactions is what reduces the risk. That particular sector and reducing it to 25% of your workforce rather than the occupancy, we struggle with the logic behind that. So again, it's not like the person saying, if you have 100,000 square foot space, the social distancing is what really limits the virus. So again, if you only had 10 people working in 100,000 square feet, I think you can easily socially distance, but it doesn't provide for that. It just says you still need to reduce by 25%. So.
Okay. Do you need to report when you have a positive case at your company, or is that on you when there's one positive case at your company, or is that something that that's taken care of?
They do not need to report that. They should look at the guidance. That outbreak guidance talks about single people versus multiple people. So it can give you all the requirements of what you should be doing. You don't have to report it to us. But if you have concerns, you're not sure what to do, first go to that guidance. And then if you're still unclear, then you can call and get support. But we don't have the bandwidth to work with every business that has a single person that's ill, especially that's not related to their business, themselves. So that's where our team is overwhelmed by how many calls may be coming in.
And every week I send out in the outbreak guidance, it's a clear step-by-step what to do. Even under the outbreak, it's if you have a sick employee, these are the steps you take. Your employee is probably telling you about it. These are the things to take to do. If you have two, there is a form that I also send out that you have to fill out and you have to submit, and that's that outbreak form that you have to submit to public health. That's when you have to report it, correct?
Yeah. It gets reported to the state specifically.
Okay. If we move to stay at home, does that affect schools, or are they on their own system?
It does affect schools. I mean, it already affects schools by us being in orange. It's really looking at remote or hybrid. And then I think it's very limited how much any in-person can happen if we're in red.
And Adams K-12 and BVSD have already made the decision to go back to be away on online. Well, BVSD starting on next week, Adams K-12 through the end of the year. We don't know about Same Brain. Same Brain's still operating at a hybrid level. So, all right, we still have more questions. I get told all the time, you guys and I were talking about this, how people say nobody submits questions on Zoom webinars, and we get hundreds of them. So I feel like we're interacting. I appreciate people sending in questions. We're getting to them. Can you clarify the sports and the practice guidance again, Jesse? Because I think that was news to some people on this call.
Yes, and it was news to us earlier this week. So the state,
and if it's led by a staff and team practices led by coach, I think there's just some confusion. Let's take a rec center for example. If you
if you have a regular team practice, if you have a regular team game that happens in a recreation center, that's not allowed under current conditions. If because of that change, you know, it was suggested that teams could practice instead, that is also, according to the state, not allowed. Teams cannot practice right now. However, if you are talking about a rec center class, like I guess a way to think about it would be swim practice or a swimming pool. So swimming pools are allowed to be open under orange right now, and you can go and swim. You cannot be there as part of a practice or a swim meet, but you could go swim of your own free volition. I think is the best way to think about it. And if you're there for a swim class, that's also permitted. Uh, and trying to think of another way of putting this. Another example: basketball teams. A youth basketball team can't play games, cannot practice, but gyms can still have basketball courts open for individuals to play. You know, to basically shoot baskets. They can't play a game, but they can shoot baskets.
Can you have a basketball clinic where they're learning basketball skills?
Yes, if it's organized by the recreation center, and it is limited to the correct number of people, that is possible.
So this one's, I think the easiest way, if there's any easy way, is the teams need to basically move into a training phase versus any kind of practice where there's any interaction between players. So it needs to be focused on training and socially distanced so that people aren't practicing together at all.
So it's not a soccer practice, it's soccer training and soccer clinic and soccer drills.
Yes. Where everyone's socially distant and nobody's no interaction between players.
Right.
So it's not their team. It's that. So any instruction that isn't for a team can happen indoors as long as it's following the guidance.
Yep.
Okay. What support will there be for parents who will have to stay at home for childcare as school moves online and loses income? And I think I don't think that you guys can answer that question necessarily, but I think that's a community-wide question.
No, these are big issues. I know that sort of some of the partners at Community Services and Housing Human Services, that's kind of where they've been living for months now, is sharing the different resources, what pay is available, what leaves are available for different employees, but this will again be a challenge for a lot of folks.
Mm-hmm.
So we have a question that came in that says that people have socially distanced, worn their masks, lost their holidays, and based on data has failed. Why will we have more restrictions? But I think what's happening is that people aren't wearing masks. They are coming together and having those parties on their front porch with their neighbors. They aren't socially distancing. You know, things are happening correctly in a lot of businesses, but it's when you go out and you do stuff, and so the virus is spreading, and it is causing further spread of the virus and further restrictions, and people are not taking it seriously in some of the social settings. Is that correct?
Yeah, and there's lots of different estimates out there about how many people still can get COVID, and it's 80-90% of the population, depends on what the estimates are showing. So most people have not gotten COVID and are not immune. So again, there's still a lot of people, and it would easily overwhelm our system. Again, the projections right now are that the ICU beds within the metro area are going to be at max capacity in December.
Okay, so we've answered that question. Okay, so I get this question a lot. If a member of an employee's household, for example, a roommate or a partner, had close contact and is therefore required to quarantine, so quarantine away from the employee now as well, is that employee now also in quarantine and allowed to come to work? So it's that third party question, the quarantine of a quarantine, if that employee is not the person that was exposed.
No, there's no contact of a contact that now needs to quarantine. So
that employee's roommate or partner should probably quarantine it away from the others in the household.
yeah, so again, that's the piece about quarantine. So the person who needs to quarantine truly needs to quarantine. They can't just go about living with all the other people and keep interacting with all the people in their life. That is not quarantining. So if they don't do that, now they have created a bigger loop. So if that person becomes sick, now they've created that second tier of all these people now will need to quarantine because they've been exposed by this person. So,
and if that person quarantining is a kid, for example, and you're their parent, then they can wear a mask, and like you wear a mask. You're on mute, Lane. Oh, you're talking to somebody else. Sorry, never mind. Wear a mask. Those types of things can happen, but the quarantine, that is the question we get a lot is the, it has to be that direct exposure piece.
Yep.
If someone is needing to isolate at home because they tested positive, can you give us some guidelines about how they get food, water if they don't live alone? Should we serve them food with paper plates and silverware, for instance? How do you interact with someone isolating? And I do know the person on here potentially is like maybe a father of somebody who has a positive case.
Lane, I don't know if you have any specific, there's nothing in the guidance that tells you how to do that. I would,
yeah, ideally that if they can have meals separately and still either in the room that they're isolating in, those are the goals, so that they're not just moving about the household.
And I have my best friend, my maid of honor, her daughter was COVID positive, and they had her stay in her room. They wore masks when they went in. They were very big about sanitizing. She wore a mask. They just made sure that they always sanitize in and out and all that stuff when they served her food and so forth. So separation, cleaning, those types of things. There is a question about how does someone quarantine when they live in a multi-person household? I don't know if you guys can answer that.
Yeah, ideally you need to have a room where they can be by themselves. So one room that's dedicated for them. And then if they normally share that room, you need to relocate whoever they shared that room with, so that they're not staying in the same room with anyone else.
Okay, another clarity on the 14 days, 72 hours, all that stuff. For my clarity, I understand that the no symptoms, negative tests, and need to quarantine for 14 days due to incubation. So if the person does not take meds, is symptom free for the next 72 hours, does this mean the person will still needs to be out 14 days because of the incubation?
Quarantine is 14 days. There's no exception.
right.
There's no testing. There's not based on you still being healthy after 2 days, 3 days, 10 days. It's 14 days.
You were exposed to a positive case, you're out 14 days.
Yes.
Yeah.
Now, one of the questions is people are scared to tell their employers that they were exposed because of worried about losing their jobs. And are there protections for employees?
There are some provisions to help people have paid leave, but there are protections for workers being fired. So there are protections for that. So they do need to share that information. And I think, Corinne, I don't know if you've been sharing that kind of
it's the FFCRA and some of the Department of Labor information. We're working on trying to get together a question and answer for both employees. The Boulder County is putting together an employee guide to your rights as an employee. And then we're working on some sort of question and answer on paid sick leave and those types of things. in the next week or so. So because we have a lot of questions, especially in the service industry around this, as to what's covered. So more to come. I think it depends on the employer, the size, but it's, FFCRA, paid sick leave. If you have a lot of questions about it, there are some resources that I've sent and I'll continue to send. And then there's a lot of questions about independent contractors, 1099 employees. So we will do our best to get you some information about those. Thank you, YogaPod. 1099, we're gonna see what we can get out there. Quarantining, does that include a separate bathroom whenever possible?
If possible. If not, then certainly trying to do cleaning after the sick individual has used it. But that's ideal, but we know it's not always possible.
Okay. We answered that one. Indoor tennis instruction, adult and youth, is it okay as long as it's not a team or league?
I would say, depending on how it works, if it's not a team or league and you can reduce any chances of any contact and the people can remain masked, then yes.
Okay.
Yes, classes and instruction fall under that, whatever it is, the restriction under that recreation.
But then you have, like we talked about last week, if you have a pickup game of 4 individuals, that then falls under that wouldn't work because
it's a personal gathering.
It's a personal gathering and it's more than 2 households.
Right.
In relation to isolation, if you've completed the entire time recommended and are symptom-free but still test positive, are you still contagious?
So again, you should just follow the guidance. So there are tests that are going to just pick up the virus, not necessarily active virus. So we're not telling people to test to prove that you can now go back to work. You need to follow those restrictions for isolation. So businesses should not be asking employees to continue to test themselves till they get so many negatives to return to work for either quarantine or isolation. They should follow the quarantine and isolation guidance.
Okay. And then someone said, well, my wife had the loss of, I can't even say the word, the loss of smell for almost a month. In this scenario, would they have to wait 4 days after that smell or taste comes back before coming back to work?
I would say no. If you were looking specifically at the more COVID symptoms, so again, those illness pieces, the other things that happened as a result of it are not exactly, even though loss of taste and smell, I think is one of the triggers for you to think you might have it, but we don't necessarily want you to wait until that comes back before you have to come back. So
more like the fever, the cough, the traditional ones that are on there. But in this case, a loss of smell and taste was one that lingered for this particular person. Do you have a recommendation for an app for the cell phone to use as a symptom screening tool for the employees to use before they come to work each day? I know we've sent out the symptom screening chart that the state has. Do you have an app that anybody uses?
I don't think there is a recommended app. It's I can tell you that I have been to businesses that have sort of set up a quick forms, a submittal form that you take a screen capture of a QR code and it takes you to basically just a little fillable form where you just put the information in. I recommend that, but not a particular app as far as I know.
Yeah, I talked to a couple companies today that are doing, because you don't want to just go to a Google form and everybody sees everybody else's information, but they do a Google, they do like a Google questionnaire, and then it goes into a form that one person has access to and they fill out. I know some of the sports leagues are using, a local company, Team Snaps. Team Snap created a health check type thing that they are using for their sports members before they show up for practice type thing. But I haven't heard of any. Oh, someone said COVID-19 symptom study app. I guess there are some people that are creating apps out there. Oh, can you update the chart that shows positive cases by age group? It is off the top of the chart. Just, I don't know if that was just maybe this. Oh, apparently there's a couple people are keep handing me names of
So
apps.
I think in the past I showed a different chart. It was a line graph, not this bar chart. I don't have a chart that shows anything off the top of the chart.
Okay, well, this is a different chart this week. I'm going to thank Dan on the call because he keeps sending me all these different apps. So I'll put those in for future reference for people. They're all the same. Thanks, Dan. I'll put them in. All the same app, and we'll maybe put them out there. It's like Join Zoe, and he has a couple apps that he's put in out there for people they can look at. All right, let me see if there's any more questions. When evaluating close contact at a workplace, can we take social engineering controls into consideration when evaluating the close contact and having to send people home?
Not totally sure what that question means in terms. Well, what I would say is when our team talks to your business about close contact, we will ask if people have been within 6 feet for more than 15 minutes in a full day. So if you have set up in your business space a way for your employees to work in the same space but never be within 6 feet, then you wouldn't have any close contact.
All right, so I guess this is actually so if you test positive but you never had symptoms, do you have to have 10 days from when your initial test and you never had fever? Because we're talking about you have to wait past when your fever and everything go away. How long do you have to wait before you go back to work?
That is a good question. I would say at least 10 days from that test. So
at least 10 days from testing positive. Well, I'm gonna. All right, and thank you for re-asking that. I know that it all says, certain number of days past when you last had it. Okay, I'm writing down these apps. Dan, I'm writing them all down. Okay, and then do we have any proof that restrictions on businesses reduce cases? And I just want to, I do want to note that we understand that restrictions are crushing. Jesse, Lane, and I talk about this, that we understand, we're out here talking to you, and we understand that, having to come to you and say, this is what stay at home looks like. This is, what, further restrictions would look like is tough. And we're doing everything we can to just communicate with you because we don't want you to be surprised at any point. But I know that, and I just want to just say that that's from us to you. We know that. But the question to you guys, Lane and Jesse, is what kind of proof is out there that further restrictions will reduce cases, further restrictions on businesses and further restrictions on individuals?
we can go back. I think Jesse has from March all the way to now of the cases. And so we can see what's happened, but it has reduced those over that history when we've had the different phases of lockdown. And you can see when we started relaxing things went back up. We were able to manage things pretty well throughout the summer. And then this second wave and this was something we were concerned about, and a lot of people had projected that we will see a second wave in the fall, and it's happening. But a lot of it, I think, is because people are not taking the practices. But right now we're seeing a lot of outbreaks in businesses. So as much as I keep coming back to personal gatherings as a huge concern, it doesn't mean there's no disease happening in businesses too. And it is happening. We have more business outbreaks than we can manage right now. So we're trying to staff up for that. So it's happening across our entire community right
now. How are we getting the word out about personal gatherings, about, the communication about how this is affecting our community?
There's a whole team of folks working on communication. I think Corinne's even plugged into that too. So the business community is also involved with all the communication staff from public health, from the municipalities, so social media outlets. So there's a whole host of ways, and it's nothing new. People all know what they're supposed to be doing. They're just not doing it. So it's not a matter that people don't know what they're supposed to do. They're not doing it, is the real bottom line.
And so the state of Colorado is starting what's called a Step Up Colorado campaign. And I've seen it. I mean, it's, Step Up Colorado, and they're going to have some paid ads. And I think that it's got some good messages. NOCO has a campaign, but I think we need to make it more relatable. And I'm working on some efforts with Boulder County Public Health and some of the other chambers. And I think that the businesses that are on these calls, those of you that this, further restrictions will impact you, we can work together. We can create some messages. You can put these messages out through your channels to your employees, to your customers, saying further closure will hurt me. Your salon, this will impact me as a business. Please, 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 think about that social gathering. Think about that party you were going to have this weekend, that book club you were going to do. Let's think about this, because it will impact me. Let's make the message personal for people, because Step Up Colorado is about people we don't know, but you as a business is someone they do know. And I think we can all take a part in that. And we can all make those personal decisions. I mean, I'm doing it every day as well, because I don't want any of you to be impacted. And so we can do that as well. And we can do Step Up Boulder. We can do, let's save ourselves, let's save each other. And I think that's something that we need to do. And that's just, it's just something that we need to do for each other, because I don't want to see further closures, but we're in this situation. All right, we have a couple more questions, and please submit some more if you have them. In an 8-chair salon with chairs spaced at least 6 feet apart, are we okay with having 4 stylists at a time under orange? Jesse, this is under that personal services.
Yeah, so under personal services, you are actually limited by the fire code capacity of your space. So if your room, depending on what your room's capacity is, you need to maintain the 6 feet of distancing as your first step. And then you need to say, if we're all 6 feet apart and we're masking and doing all that stuff, how many people can we have in here? It's the 6 foot distancing first, then fire code, 25% of the fire code.
So so that's something they're going to have to look at, and if it should be posted. If they don't know, their landlord probably knows.
Yeah.
So that's that personal services piece.
Right.
Any word on Thanksgiving guidance?
Just it's the same pieces around limiting your gatherings. So it's not wise to host really large gatherings. So where you can try to think about other ways for people to interact instead of everyone getting together.
All right, I'm going to do last call for questions. I think it's good we didn't have a second call after the first one, since it is an hour and a half in, and we do have a lot of questions. We did get a lot of thank you to Jesse and Lane for doing this. For everybody's knowledge, it is Veterans Day, and Jesse and Lane technically have today off, so I appreciate them doing the call today. Again, if anything changes, we will have a call at 1 o'clock on Friday. If anything changes, you will get an email from me tomorrow or Friday if anything changes, and at 1 o'clock on Friday I would reserve that time if anything goes on. All right, no more questions at this point. Lane, Jesse, go enjoy the rest of your Veterans Day if you can. I know being public health professionals is probably not possible, but thank you for all you do. And we will see you on Friday, possibly. Otherwise, we will see everybody next week for our weekly update. And everybody stay safe, stay healthy, stay with your family, enjoy your animals. And we will we'll see everybody next week. Thank you.
Thank you, Corinne. Thanks, Lane.
To all the veterans out there as well.
Yeah. Thank you.
Happy Veterans Day,
Absolutely.
everybody.
Happy Veterans Day.